Why men, being a woman,
Yeah.
is because how can you possibly understand women completely without understanding the opposite sex? And sometimes for some individuals, men and women alike, regardless of your gender identification, right, you may be dissatisfied with the way your genitalia looks. It may stop you from performing the way you want to perform or presenting yourself the way you want to present when you're in an intimate scenario with somebody else. We seek safety when there is something to blame.
Yeah.
But when we don't have a clear-cut idea of what it is to blame, is it me? Is it just me? Maybe I should work harder, I should do more. Then we struggle with coming to terms with that. And when we are aroused, we touch someone differently. We approach someone differently. We hold them differently. We stimulate them differently. We're probably more giving without realizing we're actually working to give. Always tell someone, your fantasy is your private space. If you choose to share your fantasy with someone and someone feels offended by it, not on you. Because you did everything in your own power to feel stimulated. The idea is we naturally all want novelty. We want different things. We want new vigor, new stimulation, new sexual energy. We're human nonetheless. We cave into the pressures of judgment. And it's surrounding yourself with a good group of people. And you know, we can't care for everyone. I love this equation, and it's attraction plus obstacle equals excitement.
Welcome to the Wellness Collective. I'm your host, Dr. Chai Ling. Today's episode, titled Why Your Sex Life Doesn't End After 50, Insights from a GP, features Dr. Jessherin Sidhu, a general practitioner who specializes in menopausal medicine, male and female sexual health. Dr. Sidhu brings a unique combination of personal experience and professional expertise to a topic often regarded as taboo. Join us as we delve into an enlightening conversation about sexual health and the vibrant possibility that exists beyond 50. Thank you so much for coming. So, how did you come about to kind of have a special interest in male and female sexual health?
It's quite interesting because with most of what I do, everything stems from what I feel personally. So with regards to sexual health, what happened was I personally had a journey with sexual dysfunction.
Oh, really?
So sexual pain in general. So that really kicked off a point in my life where I was already working with an STD clinic. And people used to think that sexual health is just sexually transmitted infections, right? So then when I had this problem some time back, overcome it on my own, no assistance whatsoever. And then I went, who the hell is looking after day-to-day issues for women, Who addresses sexual pain? Who addresses dissatisfaction with sex? Who addresses that, am I just supposed to lie there and just experience this? So then that sort of spurred the whole, somebody's got to attend to it. Surely there's a field of medicine. And lo and behold, there was one. It's called sexual medicine. And so I decided this is something I needed to delve in. And why men, being a woman, is because how can you possibly understand women completely without understanding the opposite sex?
That's such a good point. And then through your own journey, how did you find help? Did you have to go and look for professionals? Did you read books? I don't know, ChatGPT?
So you just dive straight into it until the point it became better. So, which is why it was unassisted. And you're going, if you experience.
So you didn't have anyone helping you?
No. This is 25 years back, almost 30 years back. And you wouldn't think that there was any assistance to be rendered at that point in time. And then coming from, lo and behold, many of us came from conservative backgrounds, right? We don't speak about sex. In fact, even in Western culture, people don't really talk about the specifics of sex in any family.
That's true.
Very rarely would you find that. But affection wasn't something that was overtly displayed in the family I grew up with. So being conservative like that, and then when you experience a dysfunction, you keep it to yourself. You keep it to yourself and then you plow through it. And then I go, no, this is not right. The people around me shouldn't have to plow through it. And if I have an interest in this, then let's provide a service.
That's interesting because when people look at you, because your background is a doctor, they would think you would know everything because they just assumes that, doctors can fix everything. But actually that's not true, right?
Doctors
it's a special,
we're definitely not the know-all and be-all. And often we get to where we get to because there was something that pushed us along or that spurred us, or we experienced something negative ourselves. And that is often a classic story as to why we choose certain professions to be in. But that may not be the story for all of us.
So what sort of patients do you usually see in your practice? practice? What is the most common presenting complaint?
Okay, so let's see. The kind of work that we do in the clinic is quite varied, right? So a good portion of my work is dysfunction. So anything that's meant to be functional but it's not quite working the way it should. So we see a lot of women, if I speak about women first, we see a lot of women with sexual dysfunctions. So sexual pain being the most common.
I think that's most common, right?
is a big crux of what I do. And then after that, problems with sexual desire and arousal. And then after that comes the across the lifetime of a woman. So it can be contraception at the beginning, and then in midlife or the midlife crises of menopause, the issues that come with it is very rampant now. So we're seeing a lot of that come through. And now it's becoming fashionable to deal with menopause. Right?
Wow,
so it's in vogue now. People are talking about it. Great. There's a lot of noise and churn around
I think that's
this.
great.
So, and then with men, we're seeing issues that have been addressed for a long time. You know, andrology, issues around erectile dysfunction has been an issue that has been addressed by many physicians, but not many female physicians address sexual dysfunction in men. And of course, another part of our work is aesthetics. But we don't do facial aesthetics, we don't do bodily aesthetics, we do just genital.
Oh, really?
So, like we say, you know, the way you present yourself, the outermost layer, the superficial layer is your skin, right?
See.
And sometimes for some individuals, men and women alike, regardless of your gender identification, right, you may be dissatisfied with the way your genitalia looks. It may stop you from performing the way you want to perform or presenting yourself the way you want to present when you're in an intimate scenario with somebody else.
So what sort of aesthetic treatments or procedures do you do for the genitalia?
So I think the one that caters to most individuals is inner thigh and genital lightening. So that's a concern a lot of women in particular find themselves bothered
especially Asian women, right? We tend to have more pigmentation.
We're more likely to pigment. And then we find that a lot of women now are seeking love in midlife again. Right? Having been through a separation or a divorce. And then they feel like they're in a position where their body has changed so much. You know, they've either delivered or their body's out of form. And they have the financial backing to cater into aesthetic services like this. And they want to just better themselves from that point of view. And a lot of it comes from the idea that they're not good enough. And they're afraid of rejection. Or they worry about what someone of the opposite sex might think of them. So hence they cater into services like this. Other things that we do are probably more functional than it is purely aesthetic. So we do quite a lot of labial fillers. So we have a good group of cycling patients. So cycling is quite an avid sport now, right? It's quite fashionable to take it up. So a lot of these women in midlife are experiencing a lot of deflation of their labias, a lot of wrinkling.
That's so interesting.
So they cater to these sort of procedures just to plump it up, not just for appearance, but for cushioning as well.
I see. And how long do these fillers last?
6 to 12 months.
And then they have to repeat again.
Oh, we do tell girls, you want something more permanent than your fat transplants or your fat grafting, things like
How about
that.
things like the tightening procedures, tightening of the skin, tightening of the vaginal canal?
So we do that. So I don't categorize tightening of the vaginal canal as something purely aesthetic, but it's using an aesthetic tool, using lasers, right? So yes, we do that, but it's largely for functional improvement. So to get more tightening, to reduce the risk of vaginal infections, to get less urinary incontinence and coughing, you leak a little bit. So a lot of us midlife will experience things like that. So reduce vaginal dryness. The lasers are beautiful.
What kind of lasers would you use for something like that?
So I don't like to use the lasers that are a little bit less invasive, like more heat based, but we use proper CO2 lasers that give you a proper ablative effect. It's down to the layers where you need to get down to make collagen.
And how about those the magnetic muscle stimulation for the Kegels and all?
So again, that one falls under the functional part of it. So a lot of our work and a lot of the things that I have done in terms of my training to get to where I need to get to with my patients is I'm physiotherapy trained as well. So we do a lot of muscle releases. So if muscles are tight, you have to neutralize them first before you can strengthen them. So all these EMG stuff.
That's amazing. You cover everything.
I think you kind of have to, which is the beauty of sexual dysfunctions, because it's not one thing, solve one thing, and then you've solved the problem. So yes, these EMG machines as well are used to, they say that they can do 11,000 Kegels for you in 20 minutes. But you put it on the wrong person without assessing their pelvic floor first, and if they're already tight, you're going to create dramas.
Understand. Then how about for men? Do they also seek aesthetic treatments? I don't know, fillers for penis?
Yes, actually.
Make it bigger?
It's actually a service that we are are starting.
Oh, really?
Because I now have a male doctor on board in my clinic. So we are starting up a service like that.
For
I've always
penis enlargement.
Penis enlargement. It's
oh my God.
purely aesthetic. It's purely for girth enlargement.
Right.
In a very select group of male clients or male patients, provided we are very, very certain that there isn't any mental health concern in the background.
Right.
That is spurring their desire to get the enlargement done.
Okay.
So yes, there's those sort of things that can be done too. Actually, there are a lot of men who cater into genital lightening.
Oh, really?
In fact, it's more the inner thighs than it is the actual genitalia.
So the men like the penises wide and large?
It's not so much the penis. So I think a lot of people are very reasonable. They're not looking for lightening of the penis, but they're looking for the frictional areas of the body.
Oh, I see. More even tone.
Yeah, the inner thighs. So there are many people who...
I'm surprised because usually at night, wouldn't people turn off all the lights? But I guess maybe, nowadays, the appearance would matter a lot.
So many things like getting and receiving oral sex.
Right?
Okay. So sometimes the darkness just takes away the stimulation. You take away the element of visual stimulation.
Oh, okay.
And some people enjoy a dim light on to appreciate the body rather than just the feel or the taste of something. So they like these multi-level or multimodal stimulation to the sexual experience. It just amps it up.
I'm really loving this conversation already. I have so many questions to ask you. I don't know where to start. So I'm going to start from the women, okay? Just now you said that you see all the way from sexual pain to menopause. That means that your clients are from young to older, or is there like one age where women will flock to you?
Young to older.
Young to older, okay.
I have seen 18-year-olds, 16, 17-year-olds actually being brought in by their moms.
Oh, really?
And bless them, they've got excellent relationship with their mothers.
Yes.
And sometimes, I wish I kind of had that kind of openness.
Yeah, I definitely didn't.
And so, it really sometimes makes me very emotional when I see these girls come in with their moms. I'm like, wow, you're lucky.
Yeah.
And often these are very young girls who are actually going overseas to stay in uni, stay in dorms.
Okay.
So mothers sort of preempt that you might be having some sort of sexual experience. And they share that, they are struggling with their partners at the moment and they worry that this might be an issue down the road. So mums bring them in and they actually see me for things like vaginismus.
Oh, so they do have sexual pain, or is it just for sexual education?
No, it's not just for sexual education. So these girls may have tried, may have attempted with their partners, but they find that they are unable. And pain gets in the way, and pain is this huge obstacle that then they go, it then allows for the development of fear.
Yes.
And once fear develops, then you're dealing with a huge psychological arm of the problem.
Yeah.
So yes, from very young girls, 16 and above, right up to women who are menopausing, midlife. So midlife issue, menopause hits you like a wrecking ball. So you do get those women coming at that age group as well. I wouldn't say I see much older women, like in their 70s. I would say the profile I see probably ends off just below the age of 70.
Then before menopause, do you see the ones, the middle age, but loss of desire? Because I think that one, a lot of people wouldn't seek like help because they think it's normal, they brush it aside. Whereas sexual pain and menopause, people almost will seek help, but in between,
I think that's how we are, isn't it? Whenever we are clear we've got something to blame, it's a dysfunction, it's a problem with the body,
but
I feel
it's not
okay to go ahead and seek help for it. But when it's a desire issue, we normalize it by going, I'm female, my desire is supposed to be lower than
normal.
a guy anyway. It's normal. So that's what it is. We seek safety when there is something to blame. But when we don't have a clear-cut idea of what it is to blame, is it me? Is it just me? Maybe I should work harder, I should do more. Then we struggle with coming to terms with that.
Yes.
And I think there's this huge misunderstanding or misconception that, guys are ever ready, right? Like Energizer battery, Energizer bunny, ready to go anytime. And that women are the ones with the lower sexual desire.
Is that true, or is that a myth?
No, it's a myth. Sex has to be approached in a very individualistic manner. Yes, men are driven by testosterone. Yes, in general, their visual sexual stimulation is a lot stronger than women. But when we come to terms and accept the differences between the feminine approach to sex and the masculine approach to sex, we can actually get rid of a lot of problems that we have, because then we adjust our expectations of each other. And we can amp our own expectations up. If I know that, and this is why we tell people, when you pick partners, make sure you have shared values around sex. You don't go and say, I want a goody two-shoe as my wife. you know. I want her to be someone who is not promiscuous with others, who's had no experience before. There's some people who pick partners like that, you know.
I have patients who tell me they've never consummated their marriage before marriage. So the first time they had a sexual experience with their partners is after marriage.
Yes. So this is not an uncommon scenario in the Asian
in Singapore
context.
especially, right? Yeah.
Yes. And in Singapore, where we are so busy and we have so much of external stimulation, so much of other what I call reward systems, you know, we get rewarded through our work, we get rewarded through Netflix, we get rewarded through TikTok or whatever have you. There's so many things to easily distract us and give us simple, quick reward systems. Sex doesn't become a reward system then, and especially if we don't devil in it enough, we don't talk about intimacy enough, we don't seek pleasure from touches that we receive on a day-to-day basis, and we have very misconstrued scripts of sex. So you know, sex is, oh, you know, I got to be in the bedroom, it's got to be on the bed, it's got to be penis inside me, it's got to be up to the point of orgasm. This is a very fixed, scripted way to have sex, and therefore we lose the idea of what's riding the pleasure wave. So you can experience a lot of pleasure, peak pleasure, minimal pleasure, but it is still sex. So mutual pleasure doesn't mean must orgasm. Must orgasm at same time. And all of that is all.
So is that something you teach your clients?
We do, because then it adjusts a lot of expectations they set on themselves. Particularly for men as well. Like they get into a scenario and they get really affected when they don't have strong, solid, vigorous erections, right?
Yes. Or if they cannot make their partner orgasm.
So we go, wait, what? Since when was sex charity work? Since when were you responsible for somebody else's orgasm? Someone's orgasm is their own responsibility. Why they might not have felt it in that moment is on them. It's not exactly on you. Take, for example, someone could be stimulating one part of your body on day one. On day two, they do the exact same thing and you might not feel it so much. But why? Is that on them? The activity they did is exactly the same. But it's us, because we perceive the sensation differently on these two separate days. And therefore, one might lead to an orgasm and the next day it might not.
So what are the common misconceptions that you have to clear up with your patients?
Wow, so many sexual misconceptions. But if I were to break it down to things like sexual desire, one of the biggest ones is that men have more desire than women.
That's not true.
And no, that's not true. And that mutual pleasure is called orgasming together. And that's when you know you have best achieved, you know.
But that's not true too, because actually it doesn't have to have orgasm. That's what you're saying. Like, just foreplay without orgasm is also okay? Because you know, men feel like they have not achieved the goal if it does not accumulate in a mutual orgasm.
I think we tend to be very target oriented. If we do something, oh, what's the target, what's the outcome? If I don't get that, it's scripting, like goes back to how we are scripted, right? And some of the other misconceptions can come with, take for example, orgasming that we spoke about, and also arousal. So a lot of us, are women in particular, very fixated. Oh, I can have vaginal orgasm, I can have vaginal arousal, but I can have clitoris arousal, but I cannot have vaginal or arousal or orgasm. So we like to again delineate body parts. I can do this, but I cannot do that. And we go, hold on, it's really not about clitoris. I can get aroused by clitoris, or I can't get aroused by vagina. It's actually the whole complex. The clitoris, the urine hole, the vagina are really so close to each other. In fact, everything is being stimulated, but you're only aware of one.
So what do you say to women who says that to you?
So take for example, women who tell me, I can't have a vaginal orgasm. Like when I'm having sex with my partner and they're inside me, I feel nothing. It's very blah. It's very neutral. Then I go, okay. Now, who made it neutral for you? Your partner is enjoying themselves. But whatever stopped you from stimulating your clitoris while that is happening?
I see. So you're actually empowering them to take control also, you know, of the situation, to increase their pleasure.
So the idea is control of self, not of situation. And if you know what works for you, don't stop yourself from doing it. And what might stop you is what you think your partner will think.
That's actually very true, because a lot of women start thinking, if I do that, what will my partner think, you know?
Because they feed into this idea of the male ego, which is like, oh, my partner must be the source of my arousal, must be the source of my stimulation. But the male ego is not so rigid like that. If the male ego or the male person actually understood that if you did this by yourself, on yourself, while this other mutual thing is happening, then you are stimulating yourself. They stand to gain because you're more aroused.
Okay.
And when we are aroused, we touch someone differently. We approach someone differently.
I see.
We hold them differently.
Okay.
We stimulate them differently. We're probably more giving.
Yeah.
Without realizing we're actually working to give.
Yeah. So what would you say to this really common problem, even amongst my friends, who says that they have no more sexual desire with their partner because they've been together for so long? And that's true, right? Because if you've been with somebody for, say, 10, 15 years, surely it's normal for sexual desire to go down, or is it a myth? You know?
It's absolutely true. I would be darned if someone told me they've been with someone 15 years
and you still
have the same fiery
So is it
sexual
okay
desire.
to think of Ryan Gosling while you're having sex with your husband, or not okay?
No, yes. Absolutely okay. I always tell someone, your fantasy is your private space. If you choose to share your fantasy with someone and someone feels offended by it, not on you.
Yeah.
Because you did everything in your own power to feel stimulated.
Right.
I don't know whether people have heard of the Coolidge effect. So this is it's a running joke. We're not sure whether this ever really happened or not. Okay.
Yeah.
XXX US president at some point in time, right? They went to a farm. Him and the first lady went to a farm, and they saw some chickens. And there's this rooster there that is mating with all these chickens, right?
Yeah.
And the first lady goes, oh wow, told the farmer, oh wow, go tell the president, take a look at that rooster. He's really banging all the chickens, right? And then I said, make sure you tell the president that. So the farmer goes up to the president and say, hey, the first lady said, take a look at that rooster. He's banging, he's banging this particular chicken, like really, really having a good go at it. Seems to be enjoying himself. And then the president said, tell the first lady, the rooster's not banging one chicken. He's banging many chickens. So the idea is we naturally all want novelty.
Yeah.
We want different things.
Yes.
We want new vigor, new stimulation, new sexual energy.
So what do we do if you only have one partner?
So when you only have one partner, the idea is bringing in new novelty. So you either change up what you're doing.
So it takes some effort.
It takes some effort. It does take some effort, but it can only come in when both are openly discussing, openly communicating, not being afraid to be vulnerable when you want something, not making silent assumptions that my partner will think something of me if I were to ask if this is okay, or sometimes I have a fantasy of this, or sometimes I want to do this, sometimes I want to leave the curtains a little bit more open, take the risk that the neighbor can see me, So, and this is our internal eroticism. We all have a built erotic template that governs us.
So does it mean you have to see both partners in the same setting?
We don't always have to see both partners in one setting. If a patient or a client comes in and they want to have their partner in, we say, oh, yay, this is great, because I get more info, I get more insight as to what's going on. But if someone says they're not comfortable, and there may be many reasons why they're not comfortable, because they're sharing vulnerable things with you for the first time, and the last thing they want is a partner there.
Yes.
And they feel stressed by this situation. They might not be able to openly share.
So maybe start with a one-on-one.
Yes. Then they'll go like, okay, now I feel okay to have somebody else in the room with me.
Yeah. So, as a woman gets older and it hits menopause, now what are the most common issues you hear about women when they hit menopause? Is it like the fact that they feel invisible, or is it loss of sexual desire, or physical symptoms? They actually have dryness.
That's definitely there. But with menopause, a lot of it is around the mental capacity and the mental functioning. So they come in going, I can't sleep, and I've got brain fog, and I cannot find the words to say certain things. I feel like I'm just not functioning the way I used to. I'm getting irritated with my family. I'm getting bitchy towards my husband. I'm just shouting at my kids. I can't perform at work. So for women, because that demand is so strong, we're caregivers in the home setting. We're also performers at work. And so that takes a lot out of us. So the moment we see our performance drop, our functionality drops. That's what irritates us the most. But yes, sexual pain, vaginal dryness, then that's another challenge on the dutifulness as a woman to keep sexuality going, keep sexual performance going in the relationship, because often the fear kicks in, I'm only midlife, and if I can't do this the way I think it should be done, which is penetrative sex, then
will my partner go and look for someone else or something, right?
That's an internalized fear.
Yes.
That, or will he be less satisfied?
Yes.
And often they don't question their own satisfaction.
Yes.
They
A
always
lot of women don't
question
think about
a
themselves.
partner's satisfaction. And that's just the way it runs, because the masculinity is, or the masculine being is the one that is more demanding of sexual pleasure.
Yeah.
And like I said, nowadays we have many avenues of receiving rewards in our life, and then sex becomes diminished. But it's a non-problem if both parties feel the same way, right? Then it's no problem lah. One has the sexual desire has lessened. Maybe the other partner has a bit of ED. They go, hey, we don't really need.
Then
this
it's like
so
two
much.
problems become a solution, but that's not good.
Exactly. So we talk about congruence. So when both are the same, no distress. But when you have the incongruence,
yes, I think that's when the distress
comes
But
in.
that's where you also hear a lot of women faking orgasms, but you don't hear about men faking orgasms.
Yeah, a bit hard for men.
But they truly want to reach a goal. But for women, because they are so duty bound, they care about their partner's feelings, so they would rather fake it at the expense of their own pleasure.
A lot of men care about their partner's feelings too, because it's the idea of have I pleasured?
Okay.
It feeds into the ego, right? It feeds into the ego. Have I pleasured? Of course, there's a group of men who just are very much focused on their own pleasure. But there are many, many men out there, and I hear this many times in clinic. I let my partner come first. I let my partner come first.
Okay.
And I'm like, hold on, people. Women can come many times, right? You can come once. Then you have a refractory period where your body just disallows you to function for maybe 20, 30 minutes, maybe a few hours. For some people, a few days cannot function after that to get another erection and feel another orgasm. But women can come multiple times. You don't have to let them come first. But the idea here is that in a relationship, in a sexual relationship, women can come faster. So it's the idea of a give and take, I know you can come faster. And if we offer you a little bit of that, you feel satisfied. And what happens when we receive good things, reward? We're more likely to give. And that's just...
and it's not always 50-50, it's like 60-40, sometimes you give more.
It doesn't really matter, because somebody might want to run the wave where you go, I want to go all the way to the peak orgasm, but someone else might go, I just want pleasure. I just want to... Right, like nice little wave.
So what do you do for these women that have menopausal issues as well as sexual dysfunction? Is there any simple ways that our listeners can do for themselves to, perk themselves up? Is it supplements? Is it exercise, diet?
In menopause, it's not exactly so simple. But yes, a lot of menopausal supplements out there can help with just moderating a little bit.
But to an extent only, right?
To an extent only. And then after that, it's a lot about if you're depleted in your hormones, then gotta take back lah. You gotta
so
get
you do
the
some
hormones.
hormone replacement therapy too?
We do quite a lot of menopause hormone therapy.
Is it transdermal through the skin or oral?
We use transdermal versions are versions which are safest when it comes to reducing breast cancer risk, reducing blood clot risk. They're usually the safer versions to use. But we have orals too.
Right.
And
do you do that for people with no more uterus, or even when they still have a uterus?
So if they have no more uterus, commonly in menopause hormone therapy, it's about the estrogen, right? But if you have a uterus intact, then you need the other hormone, which is the progesterone. Because you just need to protect. Otherwise, the estrogen will make the lining of the uterus build. Then your uterus cancer risk goes up. But if you don't have a uterus, then you're just dealing with taking estrogen alone. But beyond the known hormones of estrogen and progesterone, we deal with a lot of testosterone when it comes to low libido in menopausal women. So testosterone actually has got very good data in post-menopausal women. So
and women don't actually know, but they actually have testosterone in the body. They always think of it as a male hormone, right?
And men have estrogen in their bodies too. And it's
just
needed
different
for
levels,
bone
right?
strength, right? And it's just at different levels. And that's what it is.
And I think sometimes it's also a mindset change, you always hear people say things like, oh, you don't dress like a 50-year-old, you don't dress like a 60-year-old. So I think when women hit a certain age, maybe it's the mindset that, oh, I'm old, should I even be so kinky with sex,
This is all societal pressures and how we feel like we're supposed to present ourselves. And I say, stay individualistic, Stay true to how you feel. Stay honest to how you feel within yourself. And if you feel like a 30-year-old, so be it. But we're human nonetheless. We cave into the pressures of judgment. And it's surrounding yourself with a good group of people. And, we can't care for everyone, can we? You care about those who mean well to you and who would give you critical feedback, you know. And those are the kind of people you want to keep.
That's actually
their
so
judgment will
empowering.
matter.
Yeah. So when it comes to men then, what are the common age groups that you see them for sexual issues?
So men, anywhere 20s right up
in the
to
20s, they have
20s.
problems, but men are so horny in the 20s, no?
So psychological ED, erectile dysfunction is actually a very common problem.
Oh, really?
In younger men. There's a lot of pressure to perform.
I see.
So performance anxiety becomes a concern because just classically we say, I have done, a guy would say, I've done a woman, right?
Yeah.
It's I've been done, and a woman has been done too, but a man is the doer. So the doer implies that the tool has to work, right? To do something. Whereas the women feels like you're on the receiving end.
That you don't have to do
action.
Anything and all these nuances.
So these little nuances create these expectations, you know. So for men, even younger men will experience things like erectile dysfunction. Often it is psychological. And the penis is a structure where you either use it or you lose it. So the more you see solid erections happening, the more reinforcing it is. The less you see it happen, the more reinforcing it is that it's not working.
Yeah, so it could be a whole vicious cycle that it didn't work one time and then they get psychological issues and it doesn't work again.
So what tends to happen is that we get them to break out of that loop and see solid, bigger erections. So this is where the utility of age-old devices like vacuum erection device and vacuum pumps are coming back into fashion.
Do they work?
They do, because they're providing what we call penile rehabilitation.
I see.
So you rehabilitate the penis back by actively exercising it, right?
I see.
And how to exercise with full focus and concentration when you're with someone. A little bit hard
so
because
something you do
part
alone.
of you is not fully self-focused. It's dedicated to somebody else. So when you're using a penile pump, you are pushing blood into the penis.
So that is just to encourage penile erections. Understand.
But when you use it, you won't lose it. Right? So you keep enforcing flow. So every time you enforce flow, you also encourage the testosterone receptors, the stuff that binds to the hormone, to actually work better.
So it's like deadlifts, getting your muscle used to it.
You can call it that.
So how about penis size? You know, men are so focused about penis size. Is it true that young men are very concerned about penis sizes?
Yes, and that's because of how they've been socially scripted again. Because, bigger means more masculine.
And better
healthier.
pleasure.
And better pleasure. But that's the problem, which is why we deal with both men and women in our clinic. Because when you understand women, or when you deal with women, you can understand and you can tell a guy, hey, actually, women don't really want anything so gigantic and big. Because bloody hell, it hurts.
It can be painful.
So we don't want something that is huge. We don't want something that is too long. I mean, where are you going to go? The vagina is only 10 centimeters long in an unaroused state. Maximum length, maybe 14, 15 centimeters when aroused. But seriously, where are you going to go with all that length? And so when you deal with both sexes, it is nice because it helps to realign, readjust expectations again. But yes, people are fixated with size and length, and often the scenario not comes because they think their partner is dissatisfied. It's their self-dissatisfied. And I've had a situation where a couple of men have come in and in a gym toilet situation, bathroom situation,
comparing penis size.
Yes, because they're all walking around, particularly those who travel a lot, Europe and all. The gyms are open, the men just come out and then they're walking around and they get very conscious of their size then. They go, I'm walking around in this gym and I feel like I'm the only one who can't remove my towel and get out of the bathroom. I have to cover myself. So they don't feel as cool as the rest, as casual as the rest.
So what do you do for men like that? Do you do the penis fillers then?
No, I mean, we don't go straight up and go, okay, if that's your problem, then let's just make it bigger. The idea is addressing the mental health component first.
That it's okay. Why do you
like
feel that way?
Why can't we confidently come up in a towel and show off your abs and stuff?
Exactly.
Why do you have to focus on the genitalia? Completely a different cultural background, completely different racial background. So why have that demand on our bodies in a gym situation? But it's good to address that that's how they feel because it makes them feel completely heard rather than go, oh, it's not an issue, you know.
Yeah.
It is an issue for them.
Yeah.
But the idea is everyone wants to feel completely seen and completely heard.
Yeah.
And therefore addressing that component is important. And if they come and say, look, you know, I still would like to enlarge it. Thank you for addressing that, but I still would like to enlarge it. Sure.
Okay.
Why not?
Okay. So when you do a procedure for the penis fillers, is it painful?
It is, of course, you're gonna have the pricks, right? But of course we do it with numbing, just like with fillers anywhere else in the body. You have the initial end bite prick, and then after the fillers go in, there's the expected swelling, which quells down after a couple of days. Really not very much different to fillers on any other part of the body.
And how long does it last for?
Again, depending on the product, right?
Yeah.
So 6 to 12 months. It's a
but at least,
repeated
you know,
thing.
it's a good 6 to 12 months and not something you have to do regularly.
And after some time, some people might go, you know, this is not my concern anymore.
Yes.
Why? Because socially things change. They may have found a partner. They may have found someone who's gone, I'm actually getting pretty good sexual experiences. I feel this is less important for me.
Yeah.
And then they mature along.
Yes. And they realize that maybe
different.
size isn't everything. It's about the whole package, the arousal,
And that's the beauty of sexual medicine, because it's not just a physical entity, you know, it's really bio, psycho, sexual, relational, intrapsychic, how you feel about yourself.
Yeah. Even for arousal, I wanted to ask you, when does arousal really start? I mean, you know, when you tell your patients, does it start in the bedroom? Does it start on penetration? Or does it start way before?
Oh, arousal can start at any point in time. Arousal is a sense of awareness that you're aroused.
Okay.
And someone could literally just walk by you, run their hand down your neck, and just
that is
squeeze your
arousal.
waist, and you feel aroused.
Yes.
And that's really it.
So all these small touches are important. So the men who like don't talk to their partners, don't touch their partners and expect sex as soon as they get into the bedroom, that's not realistic, because then the arousal has to happen.
But it's also not realistic if you expect the man to, from morning the time you get please touch me appropriately all the way through, set it up like that. It's very demanding, you know.
It's true.
But sometimes it's just a very brief couple of seconds, you know, of maybe turning towards someone and not giving them a peck on the cheek as they leave the house, but maybe prolong that kiss a little bit longer.
I see.
It feels different. You know, holding someone by their waist and pushing them closer to you. That's it. Not butt slap someone or butt squeeze someone, because all of that, depending on where we come from and how we've experienced this sort of touch, it can feel like, oh, you just want to have sex. You just want to use me now. It doesn't feel romantic. It doesn't feel like, you know, I'm being elevated on a pedestal. It doesn't feel like, you know, you want me wholeheartedly, not just you want me sexually. So it is this little thing. So it's this sense of awareness and mindfulness that we tell people, you know, when you kiss your partner, don't just peck and go.
You know, when you're texting, that can have arousal too.
So anything, sometimes something cheeky, sometimes it is, some people just like the I love yous, the affirmations, right? Sometimes it's that. But remember, not everybody's love language is through communication. Some people, it's hard for them to say I love you, you know, but they can say I love you in a lot of other different ways.
I see.
So it boils down, you know, it's just so rudimentary. It boils down to communication.
Yes. Okay. Then for men that are a bit older, what issues do they also have the same problems women have, where they have a midlife crisis and they lose desire, or they feel like straying? I mean, I don't know.
For men, it's kind of like that, but it's very gradual if you're talking from the hormonal perspective. So you've got the women's arm, which is menopause. And then you've got the men's arm, which is andropause. It doesn't just stop like that for men, right? You've got the gradual decline. But what happens with men is that other psychological challenge they have, because they find that their partners in a heterosexual relationship, their partners are feeling that decline, but they're feeling they're on an incline, right?
Does that often happen? Because their sexual desire tends to be a bit higher than women.
So then the discrepancy grows, right?
Yes.
And then the distress grows. So then that's where we see a lot more of the distress come through.
Right.
Because male individuals feel like, you know, they can still keep going. They really still want this. But they feel that they might be pushed to lower their drive. They might be told things like, hey, you're old already, don't behave like that. You know? Don't be so kinky like this, you know? And then sometimes we get upset and annoyed when a partner looks at somebody else who's more attractive, and then we stop them, or we feel badly about it. But and then when we stop people from catering to things they're attracted to, then what happens is that we actually make the excitement and the arousal to that sort of thing stronger rather than weaker.
Oh, so forbidden fruit.
Yes, exactly. So there's a psychosexologist, Maureen, he put this very, very cool, I love this equation, and it's attraction plus obstacle equals excitement. So when you're attracted to something, but you make the obstacle to get it higher, your excitement is going to grow even more. So that's why porn is
so when your husband looks at a girl with big tits, you should tell him, go and look, it's okay. And don't put an obstacle in front. Be curious.
What attracted you to that?
Yeah, okay. Yeah. That's really nice and open.
Be curious.
Yeah. But this discrepancy in sexual desire midlife, that is so hard for you to address, because what can you do for couples where men still have high sex drive and they complain their partner don't have sex drive?
So we speak about mutual pleasure. And we got to understand and we often think that the partner with the low sex drive is the one with the problem.
Yeah.
And that often is not the case. The partner with the low sex drive might not be the problem at all. The partner with the high sex drive also might not be the problem at all. So the idea here is that it's that communication during sex. Now, if someone feels like doing something, and then we often say no, we openly will just say no, I don't feel like it. But when we speak, we need to speak completely. I don't actually feel like it. However, sub-clauses, right? Don't shut the door completely. Leave the door slightly ajar to allow for some flow of communication. I don't really feel like it. But but if you really feel like it, how about maybe we just do this first? Because the beauty of that is that when you let a little bit through, while you're experiencing something, you never know when your sexual arousal kicks in.
And then you're okay with it.
Then kicks off a desire for you. So when you leave the door slightly ajar and you don't say no, blanket no, shut the door, slam the door shut and say this is not happening, but you say, I really don't feel like it. But since you do have a desire for this, can we maybe just do this much first and then we see what happens. But no, don't expect me to really go all the way with you.
That's great communication.
But it's very hard to do that, isn't it, for a lot of people. And that's because
especially in our society, I think it's very hard to communicate, because I think even if I have some sexual desires, but I think it could be a bit too kinky, maybe I would be afraid to say it to my partner in case they laugh in my face, or they're like, oh my God, I can't believe, you're so perverted.
Yes. And then when we start conversations like this, hard conversation, we go, don't judge me, but I want to share this with you. But then when you already start like that, you're shooting yourself in the foot because you've spoken for the other person. And you already assume that they will judge you. You know how people always say, don't be offended, but I'm going to tell you this.
Then you already think it's bad news already, because you already said that.
So I think the idea here is, I want to share something with you. I'm not sure how you'll take this, but if I don't share with you, I don't know who else I'm going to share this with.
Nice.
That already makes someone feel special. They're put on a pedestal because, wow, you chose me to share this with. And then you go ahead and you share. And when you deliver information, you can deliver it in little waves. You don't have to throw the whole damn tsunami on someone. You can go little bits. And then you can see how they're receiving that information. And you can blatantly ask them, how do you feel about what I just said? Like literally get the information direct. Quit the silent assumptions of what you think someone's saying. Like, someone could be blankly staring at you, but it doesn't mean that they're utterly shocked by what you said. But maybe just don't know how to reply back. It's not an AI system which will give you a perfect answer, right? They are also processing their own feelings as they are trying to respond to you. They're probably going to go, you shared with them a kink, and then they're going to go, oh, I'm not so kinky. Now I feel like I should also go, oh let's try that. What if I really don't feel like it? But they don't want to seem uncool. Or, not with the program. So then they might also change the way they reply for fear of being judged. I mean, that's the complexity of human interaction.
I know. It all boils down to all these silent assumptions and communication. And if you didn't have all these silent assumptions, I think the barriers to all these sexual issues will be broken down, I think.
But sometimes friction, difficulties are the very pillar of eroticism.
Like you said, with a bit of obstacle, that excitement. So
absolutely. And you hear this classic thing, right? In couples who someone had done something, maybe there was infidelity or there was a moment of a slip. Like they might have had paid sex outside and then they come in a situation and they go, I've done something bad.
Yeah.
But I really can't keep this within me anymore. I need to share it with you.
Yeah.
Now, often in that scenario, what happens? It's not immediate upset,
Oh, really?
It's that sense of, feel so sorry that the tension that we were experiencing led to that.
Okay.
And what often happens in a lot of couples is that they end up making out.
Really?
Having sex.
Okay.
After
That's so
that sort
interesting.
of a declaration. And that's the friction which fuels the eroticism.
I understand.
So it goes like, wow, you shared with me something so vulnerable.
Yeah.
I feel like, I had a special place and that you couldn't contain it anymore. That tells me that you just don't want to lie to me anymore.
I see.
And so it fuels different things, which is why we say we can't have it perfect all the time because there's no more novelty in that.
Yes.
There's just no more novelty.
Is that why also some partners have infidelity? Because there is this whole attraction plus the obstacle.
Yeah.
And therefore, it seems like the sex with this secret lover is so exciting.
Yes.
Yeah.
Yes.
Whereas with your partner, there is no obstacle. It seems so plain vanilla.
Yes.
Yeah.
Yes. That's absolutely it. And with the other parties who are outside, you're not with them all the time.
Yeah.
So you don't get the other quirks of being in a long-term relationship or downfalls of being in a long-term relationship or boredom that comes with that. So it always feels a little bit more exciting.
Yes. And then when they finally leave this one to go out with this one, after a while, it actually becomes the same problem when this new one becomes your long-term partner.
So that's the Coolidge effect.
Wow. Yeah. Okay. So how about as the men get older, you were saying that andropause is this whole constant decline. Do they experience more erectile dysfunction issues, and at what age does this start?
So with hormones that drop for men, it drops like 1% every year after the age of 50.
Yeah.
So hormones can be a contributor to someone's declining sexual function.
Yeah.
And it's not just the hormones, it's the body aging, right?
Yeah.
So, the muscle strength starts to drop, stamina starts to drop, vessels start to choke and block.
Yes.
And really for an erection, you do need good blood vessel flow, good nerve flow. But interestingly, you don't need an erection for pleasure.
Yeah.
So
Okay.
you need an erection, solid one for penetration. But if in a couple setting or whatever your situation is, couple, throuple, whatever, if you can have sex and you can have pleasure, sexual pleasure without full solid erections, you're still getting where you want to get to.
Really?
Which is you're being pleasured.
I see.
And so that's what we need to aim for. We need to aim to ride a pleasure wave.
I see.
Orgasm is not your destination.
Yes.
Orgasm is simply a consequence of what you're riding.
And it's not true that the stronger the erection, the more pleasured you are, because maybe as you get older, you can't get that sort of solid erection, but you can still have that kind of stimulation.
Yes. So they call it braingasms, right? For some people. Just thinking about something and then they orgasm.
Yeah.
Very few people can hone into something like that because it requires a high degree of self-focus when you do that. A lot of us are reliant on the direct touches, the easy access buttons. You know, touch, I feel it's very straightforward. It feels more straightforward. And it's okay for us to feel, to stay in that simplicity of things. We don't have to go and achieve braingasms and all.
True.
So it's whatever you feel satisfied with.
Yeah. And isn't this whole erectile dysfunction thing sort of like a curve? Because a lot of the men that I know, they think erectile dysfunction is when they don't have erections. So it's like they're okay, and then one day they do have erections. But actually, it's a constant decline. So like maybe not having strong enough erections or lasting very long, those are just actually a decline where they can start seeking help.
Yes, they can start seeking help there. A lot of men also start seeking help even before that happens.
Oh, really? Okay.
So there are a good group of diabetic patients, patients with diabetes or other conditions in the background that they know will potentially lead up to problems, physical problems with erections down the road.
Right.
And usually these are men who are very attuned, they're very well aware of their bodies and they go, I have this problem in the background. I really don't want this worsening this because this is a good part of my life.
Yes.
And I'd like to keep this going. Yeah. Can I come in and go for procedures like shockwave therapy, And these are therapies where we introduce powerful sound waves into the penile tissue. And the penis is not just what you see externally. There's internal penis tissue as well. So we stimulate those areas with shockwave.
And what does that shockwave therapy do?
It forces the building of blood vessels. So more
blood
tram
vessels.
lines, more train tracks, so more conduits for blood flow.
And how often do they have to do this before they see a difference?
Commonly, you build vessels at about the 3-month 3-month mark from starting it.
Also, like weekly for 3 months?
No, you do it either up to twice a week.
Okay.
And one cycle is what we call 6 sessions. So in 3 weeks, you're done with one cycle.
I see.
Then if you go on to a second cycle, maximum we ever do is 3 cycles, depending on background medical
and
issues.
they see a difference. As this is not just for diabetics, for any men that start to have some sexual dysfunction.
But if you never started with a problem, it would be hard for you to appreciate a difference.
Yes, of course.
You're just
it's like anti-aging. If you're young and you
Yes.
put the anti-aging cream, you don't know if it works.
No, exactly.
Understand?
Yeah. But
can men do it prophylactically?
Yes,
like,
you can do it prophylactically.
Okay.
Shockwave is now first-line treatment for erectile dysfunction.
Oh, really? Not
Yes.
Viagra and Cialis and...
Viagra and Cialis are band-aids, right? They mask
symptomatic.
a problem.
Yeah.
Yes.
Okay.
And it's nice to have that because we spoke about use it or lose it, and you spoke about breaking out of a vicious cycle.
Right.
Sometimes if you see yourself getting a good erection, you go, I can.
Yeah, because
That's
sometimes it could be
doable.
psychological and everything.
So
Okay.
yeah.
I see. So are there any other therapies that men of these age groups seek from you?
There are novel therapies, of course, by standards of Ministry of Health, not permitted for use in Singapore, not permitted to be advertised in Singapore, and I think even in the aesthetic field, they speak about this as well. It's platelet-rich plasma, growth factors,
those tend to be quite iffy in Singapore.
Regenerative medicine, right? And we know that globally there's a lot of data for regenerative medicine.
Okay, interesting.
In sexual medicine, it's very widely used. We can use it in women for what we call orgasm shots.
Oh, really? What do you do
shots.
to enhance the G-spot?
So, you can put it into the G-spot area provided somebody already has existing vaginal orgasms, meaning they can orgasm through a penetration
and then they've lost it over
easily.
time.
We also inject it underneath the clitoris, the head of the clitoris, so to the internal part of the clitoris.
So basically, it regenerates the nerve fibers so you get more sensation?
Yes, so regenerate tissue, nerve fibers, supportive structures.
Wow.
And also for women just above the vagina, below the urine hole, very small space.
Okay,
we call it the skin glands.
I see.
Right, and that's your lubricating glands. That's the glands that makes you feel like you're going to pee when you're
Right.
So then we enhance those glands through regenerative
so many things
medicines.
to enhance. Yeah. Very good. But how about all those things that I hear men talk about, like tongkat, ali and all that?
They have basis. Yes,
really?
They have basis because what they do is that they increase all the nitrogen oxide supply in the vessels. So the vessels open up.
So what are the supplements you think that men can take?
So there is a lot of data for maca, for ashwagandha, and for certain types.
But isn't ashwagandha for stress relief? No.
Also, yes, they also have utility. They also do increase testosterone availability in the body, and also blood vessel opening. Tongkat ali, which is tribulus, that also works. And zinc and arginine. So there's a lot of data for peptides now, like arginine. But the problem is that dosage, right?
Yes.
Like how much do we need of this to really, really make a difference? So we often go, hey, if you combine so many things, is that going to work? You know, like saw palmetto as well. Is that going to work? So when you get a supplement, it can be a bit hit and miss with these things. You can choose to try like one at a go and a recommended dose.
Because the quality as well.
Yes. So supplement industry is massive and unregulated. So hard to know, what you're getting.
I think so.
How much are you getting? And then sometimes we buy so many supplements, then we realize that, inside here also has this, inside here also has that other same product. And then we end up overdoing.
And different brands actually have different bioavailability.
Yes.
One question just came to mind was you mentioned, female cyclists coming to you for labial fillers.
Yes.
Is there a case to be made that when women cycle, it actually is detrimental to the appearance of our genitalia?
It's frictional.
So anything that has friction will cause some amount of deterioration, correct?
Just like, our elbows, we're always rubbing it against the table. It causes darkening, it causes wrinkling.
I'm so glad I don't cycle then. So how about male cyclists? With all this friction, does it cause some amount of issues to their genitalia?
Not so much appearance, but more so the function of a nerve called the pudendal nerve. So the pudendal nerve is a nerve that runs through the pelvic area. So very avid, long distance cyclists, can get quite a lot of pressure there and they experience erectile dysfunction.
Oh dear.
So we have a lot of, forget cyclists, bodybuilders also.
Really?
It's amazing because bodybuilders put a lot of stress on their pelvic floors. They're always core strengthening. So they become really tight, bulky and tight. So when you have a tight muscle, you can't utilize it.
Okay.
And when it comes to erections,
you need some amount of loosening in that area,
yes,
right?
because you need the muscle to contract.
Yes.
If a muscle's tight, it
already,
flickers.
yes.
It cannot.
What would you do for men with tight pelvic floor muscles?
Physio.
Physio.
Pelvic floor physio. See a very good pelvic floor physiotherapist who is so aware of sexual dysfunctions. But bodybuilders, you can look at them and you can go, I think you've got a little bit of erectile dysfunction.
Okay. Next time I'll go and have a look at the bodybuilders.
So those group of men as well. Women too, not just men. Women who bodybuild
also have I'm
pelvic
so glad
floor
I don't cycle. I'm so glad I don't bodybuild. So I should be okay. So if there's one message you need to leave with our listeners on like sexual dysfunction, like a myth or something, a take-home message, what is it?
I think one of the pillars of sexual health, healthy sexual health, is really honesty.
Yes.
So, that's super key. And don't speak on somebody else's behalf, speak from your perspective. I feel this, this, or when someone did something and you're offended by it, sexually as well, you can go, I felt this when you did this, so that's really important. And, we go into relationships, it's always make sure you share your sexual values early.
Yes.
Versus sharing it after you've legalized a bond, like marriage, you're really asking for trouble because you're so discrepan't.
And it's actually a very important part, but people don't discuss it.
Yes, because it's stigmatized. It's how do I share? It's exposing yourself. It's vulnerability. But if we speak about it more, it's less vulnerable. It's something that is easier than to discuss.
Okay. Yeah. So definitely honesty is key. Yeah. Thank you so much for coming.
No worries.
Thank you for joining today's discussion on why your sex life doesn't have to end after 50. I'm Dr. Chai Ling, and it was a pleasure to host Dr. Jessherin Sidhu. We hope this episode has inspired you and shed light on important aspects of sexual health as we age. If Dr. Sidhu's insights resonated with you, or if you have questions about your sexual health journey, she encouraged you to reach out for guidance. Don't forget to share this episode with someone who might find it empowering. Until next time, remember, your journey to health and fulfillment continues at every age.